Hi everyone, my name is Dr. Robin Lewis. Welcome to my YouTube channel. Today we're going to be talking about hypertension. This is something that 30 to 50% of the adult population has. Now I'm going to start by asking you a question. Do you really understand what hypertension is? Because to be honest, a lot of people really do not understand what it is. And in fact, a lot of physicians or doctors don't even fully understand what it is. When I ask my patients, what do you think hypertension is? They are often giving me one of two answers. A, it's a genetic thing, so it just runs in my family, so I'm destined to get hypertension. And then the second is that it's a salt thing. I have too much salt in my diet. While both of these two things can be true for a small percentage of the population, the majority of people this does not apply to. I truly believe this lack of understanding of what hypertension is the reason that so many people just go straight to medication therapy. Or they maybe try a low salt diet, and then when that doesn't work, they go straight to medication therapy. Well, I'm here to tell you there are a ton of options, but the first step is always figuring out what is the root cause. So what is causing your hypertension versus the person next to you? Because how we get to these places can be different from person to person. So my job as a holistic practitioner is to really figure out what those root causes are. And I would suggest for you, if you want optimal deep healing, that you encourage yourself and your doctor to also explore the why behind hypertension. All right, so now that I've talked to you about what hypertension isn't, let's dive into what is hypertension. Well, true hypertension is really a disease of the blood vessels, of the vasculature. So something is happening inside the walls of those blood vessels that is causing dysfunction, and that is leading to hypertension. So what I mean by true hypertension is often referred to as primary hypertension. So this isn't to say that that's the only reason you will become hypertensive. There can be secondary causes. So for example, if you have kidney disease, that can give you high blood pressure. So that wouldn't be considered true hypertension because it's actually a product of the kidney issue and not a product of the blood vessel issue. So this is just to say that you do want to be thinking about things from a whole body perspective. So today I'm going to be talking mostly about the vascular causes because that's the majority of the people coming in the door, or at least the people who do have unexplained hypertension, meaning they can't find another reason like a kidney disorder, like diabetes or something like that. But just know that there are some of these secondary causes. And so I'm just briefly going to rattle off these secondary causes to get them out of the way so that you can understand that those are also areas to investigate. But if none of those check out, this is really how we break down the vascular types of hypertension. First up is kidney disease. So as I just mentioned, the kidney disorders can lead to things like hypertension. And how they're doing this is by fluid regulation, electrolyte regulation. So the kidneys are really responsible for eliminating fluids, waste, electrolytes, and maintaining the volume inside of your blood. So of course, if that process is disturbed, that's when hypertension can be a volume issue. You're retaining more volume of water and things like that, and therefore that's putting a lot of pressure on the system. Second up is hormone secreting tumors. So this is not a very common cause of hypertension, but it's usually a cause of very dramatic spikes in hypertension. So there can be certain tumors that secrete certain hormones that really influence our blood pressure. Third up is certainly more common than the tumors I just mentioned, and that is thyroid disorders. So we most often associate high blood pressure with hyperthyroid, meaning overactive thyroid, but you can start to see blood pressure issues in low thyroid patients as well. So that is an area where if you do have that, you're chasing the thyroid disorder, getting that under control, and then you'll watch the blood pressure decrease as a result of getting the cause under control. Fourth is something called parathyroid disorders, much less common than thyroid disorders. All you need to know is the parathyroid is responsible for calcium regulation and that too can have a big impact on things like hypertension. Fifth up is obesity. And the reason obesity is an issue is, again, it's more of a volume issue. So the bigger the person, the more blood volume you need to pump things to places. So it's actually quite mechanical in nature as to why someone would have hypertension when they have a larger weight attached to themselves. So for those sort of people, we're really chasing the weight and hoping that as our weight comes down, so can our blood pressure. And last but not least, this one's super underappreciated, and that is medication-induced hypertension. So some of our more common medications can actually elevate our blood pressure. Those are things like antidepressants, birth control, decongestants. Some of the herbal products even out there can spike the blood pressure a little bit. So this is really where we run into polypharmacy for people. You get put on a medication that increases your blood pressure, then you need to go on a medication for that blood pressure, and that blood pressure medication maybe does something else and you need to go on a medication for that. So this is why majority of the population are on pharmaceuticals, and a lot of people, especially once they reach an elderly age, are usually on multiple different types of pharmaceutical medications, is because if you don't recognize that it's the medication creating the problem, then you can end up just piling medication on top of medication, and that does not really serve the person. So that's all I'm going to say for now on these secondary causes of hypertension, but it's just to plant the seed that you really do want someone who's looking at things from a holistic perspective, because all of these different areas of your health can really lend to something like hypertension. Now let's get into the more vascular, poorly understood causes of hypertension. First, I want to start you out, warm you up a little bit with a story. This will give you a little bit of an idea as to how you can relate to someone who has hypertension for a vascular reason. So let's say you're working in a hair salon, and in that hair salon, you're being exposed to a lot of chemicals in the airs. They're using things like hair dyes, sprays. A lot of these chemicals are getting breathed in and getting into your bloodstream. Now that starts to create something called oxidative stress inside of the walls of your blood vessel lining. Understanding what that is really isn't important, but I will try and elaborate a little bit. So yeah, you're breathing things in, it's creating oxidative stress, but at that time, you're eating really well, you're taking good care of your body, you're exercising, so you're consuming a lot of foods that have antioxidants, so things like berries and green tea and stuff like that, and they're managing to keep that damage at bay. So things are in an equilibrium. So you're being exposed to some things that are damaging, but you're getting by. Then life gets stressful. You stop sleeping as much, which means you're not repairing as much. Your diet starts to slip, your routines start to slip, your stress starts spiking, and now that balance is being skewed towards damage. And then that is when someone starts developing something like hypertension. So as you can see, this is a very simplified version of it, but it's really about striking the balance between vascular damage and vascular repair. So a lot of the times there's things we are exposed to that we really can't help, like pollution in our air and things like that, chemicals in our workplace. But if you're taking good care of your body and if you're aware of these things, your body has the capacity to counter that damage. It's really when your body's capacity is lower than the amount of damage in your environment that things can go wrong. Today we're going to break down all of those different reasons why you're getting damage to the blood vessel walls, so you can really try and think about what can you relate to, therefore what can you course correct or counteract with other therapies. First up, as far as contributing factors for hypertension go, we are going to be talking about nutrition. This is naturally where my brain wants to go as a naturopathic physician, so we're definitely going to start here. And the first thing I want to mention is salt, because as a lot of you know, most people think hypertension is a salt issue. So I will say 50% of people with hypertension do fall under the category of something called being salt sensitive. And what salt sensitivity means is if you overconsume salt, your blood pressure can jump up by 10%. So this is actually only 50% of the people who have hypertension. And let me explain what it means to load up on salt. So for these salt-sensitive individuals, they usually need to be consuming upwards of 2,300 milligrams of salt a day. To put that into perspective, a large French fry from McDonald's usually has around 300 milligrams. So as you can see, this is probably more of an issue of people who are consuming a lot of fast food, processed food, really heavily salted food. If you are consuming a lot of these things, for sure, clean that up. It's bad for you for a lot of different reasons, including the excess amounts of salt. But for most of us who are cooking at home and eating not maybe perfectly, but not heavy amounts of processed foods, this probably doesn't relate to you. This probably isn't relevant. You can still play around with salt, and certainly you can eliminate those really refined processed foods that you know are not serving you, but it really isn't as big of an issue as people make it out to be. All right, next thing we're going to talk about is just nutrition as a whole. So I won't have time to go over every single nutrient that matters because, to be honest, there's really good research for a whole whack load of different types of vitamins and minerals. So it ranges from like our fat-soluble vitamins like vitamin D and E. They have a role in hypertension. Our minerals, so like zinc and selenium and magnesium and calcium, those all have a huge role. Our antioxidants that are found in our berries and things like that. The point is, having a variety of different nutrients in your body really should serve you well when it comes to hypertension prevention. Kind of for the reason I alluded to in the story earlier. You want to be building your defenses to all of the things that we're exposed to. And so all of these different plants and nutrients that we find in our good, wholesome foods, they all have different roles in the process of protecting your blood vessels from the damages that we're exposed to. So keeping things colorful, a wide variety of things, keeping your food very nutrient dense is the number one priority. Of course, you can get a little bit more nuanced with specific diets from there, but it's really making sure that you have all of these different vitamins and minerals inside of your diet so that your blood vessels can effectively counteract the damages of things like pollution, toxins, whatever we're exposed to. The cool thing is we're getting better and better at testing for these different nutritional statuses. So before, you used to have to ask people based on their symptoms and assume that they maybe are, for example, magnesium deficient or omega-3 deficient. Well, now we're getting better and better at doing testing and having better technology to do the testing of these different nutrients in our bodies. It's by no stretch a perfect science. There's still quite a bit of room for error, but because we're utilizing different samples, so blood for some things, urine for other things, stool for some things, we're getting a more clear, well-rounded picture as to someone's nutritional status, so we can get a little bit more specific and have to guess a little bit less. So I do recommend these sort of tests. By no stretch am I saying they are perfect tests and they are 100% accurate, but they're certainly more accurate than me guessing. Third up, we're going to be talking about hormones. Everyone loves talking about hormones, but that's because they're super relevant. So, for example, our sex hormones. So things like estrogen and testosterone. Well, estrogen actually has very good research to show that if you do have an abnormally low amount of estrogen, this is obviously most dramatic in things like menopause, the stiffness of your arteries can definitely increase. It creates a lot of dysfunction inside of the arteries, and that definitely leads to hypertension. And that's why once women hit menopause, they are much more likely to develop something like hypertension. On the other side, for testosterone, they have studied this and found that at no matter what age, if you have lower than normal levels of testosterone, you're going to be at a higher risk of hypertension. Of course, there are people who abuse testosterone and it goes too high, and that can also have consequences on the cardiovascular system. But what we're finding more and more now is this endemic of low testosterone in men. And they're finding that that can certainly impact your blood vessel function as well as give someone hypertension. Next up, we're talking about inflammation. Now, inflammation is relevant for probably majority of hypertension, or it's almost always a contributing factor. And the reason for this is because it directly affects the health of our blood vessel walls. So for example, there's something you can measure in the blood called CRP, C-reactive protein. And it is a marker of inflammation. It's not very specific, but if you have elevated levels of it, that's your body telling you you have very high amounts of inflammation and you need to figure out why. So that CRP has been shown to slow the function of something that dilates our blood vessels. You may or may not be aware of what this is, but it's called nitric oxide. So for example, when someone has a puffer for something like angina and chest pain, if you've ever seen someone who has really bad heart disease and they get regular chest pain, they'll take this little puffer. It's actually giving you a little dose of nitric oxide, and that powerful little molecule is dilating the blood vessels. So when your CRP is high, your nitric oxide is low. So your capacity to dilate your blood vessels is being dampened. And so this is a major reason why inflammation is such a big issue when it comes to something like hypertension. Now, you will also find that inflammation is bad for a lot of different reasons. So it's uncontrolled inflammation that leads to a lot of different diseased states. So this is why you'll find a lot of recommendations often overlap from condition to condition. So for example, exercise. Having a nice healthy exercise routine is very good for inflammation. So I'm going to prescribe a nice healthy exercise routine, which could look different from person to person, for a majority of conditions, because inflammation can be an issue for a majority of conditions. So it may seem very generic when your doctor says, you should probably move more. I suggest exercising, moving your body, whatever looks good for you. It's because it's related to inflammation and a lot of other things like your immune system. And without a good functioning immune system and really healthy amounts of inflammation, you're going to get things like hypertension, more risk of cancers. Lots of these very common diseases have a common underlying factor, and inflammation is one of those things. Where the inflammation is coming from, now that's up to your doctor to figure out. Next up, we're talking about the immune system. So as I was kind of saying just a couple seconds ago, exercise is good for your immune system, therefore good for hypertension. Yes, your immune system has a huge impact on the health of your blood vessel walls. And so this is why things like immune disorders, aka autoimmune disease, chronic infections, things like that, can have such a widespread damaging effect to the blood vessel walls and lead to things like hypertension. But you also want to be asking yourself more broad questions about your immune system. So for example, do you get a lot of colds and flus? Do you have really aggressive seasonal allergies? Are you constantly breaking out in hives? There can be low-grade cues that show me that someone's immune system isn't working very optimally, and even things like that can accumulate over time. So it doesn't have to be a full-on immune disorder for me to think that your immune system dysfunction might be contributing to your hypertension. Fifth up, let's talk about toxic exposures. So this can be coming from places like cigarettes, pollution, from construction sites you're working on, hair salons that you're going to. For example, cadmium and mercury, two heavy metals that are in a lot of different things in our environment, are notorious for beating up the blood vessel walls. And so for mercury, something that is very common for people who have had dental work a long time ago is the amalgam fillings, so the silver fillings inside of your mouth. Well, that leaching of mercury has been shown to create things like hypertension. So getting rid of these heavy metal stores inside of the body can be incredibly helpful for your cardiovascular system. So even though you have been exposed to these things, we also have detox pathways and means of getting them out. So you just want to make sure that you're lowering your exposure as well as improving the ways we eliminate toxins out of our body. The last thing we're going to talk about are emotions and their relation to things like hypertension. So this one is very interesting and is not to be kind of neglected and pushed to the side. For example, the most dramatic research they find out there for hypertension is in relation to things like trauma. It's because trauma is really turning that nervous system on. So it's putting you in this chronic fight or flight mode, which when you're in this fight or flight adrenaline type of mode, that really does increase your blood pressure. And if you're chronically in that state, that's going to have a longer, more chronic lasting effect on your blood pressure. So for example, they've done studies on this. They've looked at refugees coming from countries and having experienced a lot of trauma, and they've studied people like this and shown that they definitely have an increased risk of hypertension, are more likely to have things like hypertension. But the good news is they've also studied the treatment of things like trauma, and they have found that if you can resolve that trauma, if you can deal with that trauma and get out of that fight or flight mode, it will have good consequences to lowering blood pressure. So there is an issue, but there is also a solution. So if you know that your mental health is not well, that is another thing that you need to be addressing if you want to prevent any type of disease, but also take care of some of that hypertensive reaction from being in these really heightened states of emotion for a long period of time. Now remember, this video wasn't really intended to give you treatments, but it is intended to give you why you have hypertension, because really that is the first step, figuring out the why, the root cause behind your hypertension. And then from there, you can get to treatments that are specific to your why. So that was really the point of today. And then in future episodes, we will go over some of the treatment options and what those can be helpful for. If there are any other health topics that you would like me to cover in this channel, please comment those below. Thank you so much for listening today, and we'll see you again next week.